In 2016, the Australian government legalized access to medicinal cannabis. And since then, all healthcare professionals, including GPs like you and me, have been able to seek approval from the Therapeutic Goods Administration, the TGA, to be able to access prescriptions of medicinal cannabis to appropriate patients on a case-by-case basis. Now, I've been prescribing medicinal cannabis for about 6 months now, and let me share with you a quick step-by-step guide on how to prescribe medicinal cannabis in general practice. Now, before we dive right into it, there's a quick warning. I have realized over the past 6 months that people feel very strongly about their ability to access medicinal cannabis products in all their various forms. And believe me when I say pharmaceutical companies are coming up with more and more ways for people to ingest medicinal cannabis. And I guess without clear guidelines on how to prescribe, tread carefully and really decide if this is something that you want to get into. Now, number one are your indications. And there are allegedly about 200 indications for which you can prescribe medicinal cannabis. But the three main ones that I've generally been seeing have been anxiety, insomnia, and chronic pain. And we're talking here about non-cancer chronic pain. Now, there are a few resources where you can read a little bit more about medicinal cannabis, and I will leave them in the description below, but I'll also go through a few of them in this video. When you think about those three indications, you can decide the ratio of CBT versus THC, depending on which indication you're treating, but we will talk about that a little bit later. Now, one of the websites that I was referencing was the RACGP statement on medicinal cannabis. And you can see they even highlight their position where they basically say that there is need for further high quality research into the safety and effectiveness of medicinal cannabis products, as the current evidence is limited and inconclusive. There's a lot of information here about medicinal cannabis, the types of medicinal cannabis. Interestingly enough, when we're talking about indications, so the most evidence and the most research has been in 5 main areas, 5 main indications, and that is multiple sclerosis, epilepsy, palliative care, nausea and vomiting, and chronic non-cancer pain. And it's really cool how they do a summary of the evidence on medicinal cannabis products depending on the indication that you're prescribing for. When we scroll down to the indication that I was referencing, the chronic non-cancer pain, we're looking at the THC extract and the THC CBD extract. And as you can see, there is moderate evidence that it does help. In terms of the THC and CBD blend, there's low to moderate evidence. Now, I haven't seen any evidence in terms of treating anxiety, insomnia, although bear in mind there is very strong anecdotal evidence. And what I mean by that is there are a lot of people who feel that it really helps them. Number 2 is the types of cannabis, and we're talking CBD versus THC. And again, the difference between CBD and THC is highlighted in the RACGP document. The THC is basically the psychoactive component, and that's the one that gives you the high, whereas the CBD is the non-psychoactive component. And when I'm thinking about those 3 indications that we mainly prescribe medicinal cannabis for, anxiety, insomnia, and chronic pain, it's thought that the CBD predominant products will help mainly with anxiety, the THC predominant products will help with chronic non-cancer pain, and then the combination of both will probably help the most with insomnia. And there are a few ways that patients can ingest these products. Before I started prescribing medicinal cannabis, I did a few courses, obviously kind of driven and sponsored by pharmaceutical companies, to be honest. And the more I was listening to what they were saying, I got the sense that the experienced medicinal cannabis prescribers are mainly using oils. So that's the extract. And those are the kind of products that are slow acting and that take a while to slowly build up into your system. And when you are using the oils, you kind of start at a really low dose and you slowly titrate up to the point where the patient reaches what is called the sweet spot. So that means that if you go higher and higher in dose, patients will notice that the efficacy will get lower and lower and they'll start getting some side effects. But then the other main way that people ingest medicinal cannabis is through flower. And that is effectively a herb that you vaporize and you smoke. And there is this idea that the oils are kind of slow acting, whereas the flower, the one that you vaporize or smoke, is fast acting. And if you want to understand a little bit more about which products you will be prescribing, well, there are quite a few pharmaceutical companies that will be more than happy to give you loads of leaflets and probably free training, to be honest, if you ask for it. And they will tell you the types of oils that they have and the types of flowers that they have. And before we go into the prescription process, I just want to explain a little bit about the theory on how medicinal cannabis actually works. So there is this idea that we have endocannabinoid receptors within us and mediators and substances that kind of fill in those receptors. But for whatever reason, in those kind of main 3 indications, and obviously I mentioned that there are over 200 different other indications, it seems that those receptors aren't filled by those mediators that we produce ourselves. And the idea is that by ingesting medicinal cannabis, either in oil form or in flower form, those endocannabinoid receptors get filled and patients start getting the benefits. And as I mentioned earlier, a lot of the medicinal cannabis experts, they do seem to favor the oils because it seems that that would fit in really well with the receptor theory and the long-term benefit that you're wanting your patients to get. Now let's go into number 3, which is the prescription process. As I mentioned before, medicinal cannabis is not currently approved by the TGA, and so we have to apply for authority for each of our individual patients on a case-by-case basis if they fit the criteria to be able to prescribe medicinal cannabis. And we have to be able to document in our notes that we felt that we did a proper assessment and we identified that this patient does qualify, is eligible for medicinal cannabis. And I've created a template that I'm happy to share with you guys, full stop cannabis, and that kind of goes through everything. And I've adapted this from the many resources that I will share in the link below. And if you do want to access this template, feel free to click on the link in the description of the video. Now, there are effectively 3 things to point out before you decide to start prescribing medicinal cannabis. Now, number 1, because medicinal cannabis is a little bit of an experiment at the moment, and there are no real guidelines on how to prescribe medicinal cannabis, you have to be satisfied that your patients have accessed all mainstream, evidence-based, and safe treatments for the conditions that you are trying to treat. And so a really great example is insomnia. Realistically, first-line treatment for insomnia is CBTI, cognitive behavioral therapy, specifically for insomnia. And so realistically, if you are prescribing medicinal cannabis for insomnia, well then patients should have gone through a CBTI course first. It hasn't worked, and so you're gonna go through this little experiment to see if medicinal cannabis will help. And that sometimes is a little bit tricky to convince patients to go down the potentially longer route and probably a little bit harder route, rather than just taking some medicinal cannabis and seeing if that helps. Now, number 2 is you aren't really supposed to be prescribing medicinal cannabis to patients who are already dependent on illicit cannabis, as you can kind of see from the template that I'm going to share with you. And that is one of the questions when you are applying for authority on the TGA website. Now, obviously, the odd joint here and there is probably okay, but if your patient is smoking within 30 minutes of waking up in the morning, well, it is possible that they are addicted to cannabis. Now, I have seen a few medicinal cannabis experts suggest that harm reduction is probably the way forward here to help them come off their illicit cannabis. But again, harm reduction applies to a lot of substances that many of us don't really feel comfortable prescribing. So again, tread carefully and make sure that this is really what you want to do. And number 3 is that patients with psychosis or past history of psychosis shouldn't really be prescribed medicinal cannabis with THC within it. And then finally, medicinal cannabis shouldn't be prescribed in patients with severe liver or severe kidney disease. Now, when you go onto the TGA website, if you haven't been here before, you will have to register. You just kind of fill in your details. Otherwise, you click on login. Obviously, at this point, pop in your username and password, if you can remember it, of course. Now, if you want to seek approval to be able to prescribe medicinal cannabis for a new patient, you go into the SAS dashboard, right? And you go down to click New SAS Submission. Now, at this point, you have to kind of go through the process. Are you the prescriber? These are your details. Scroll down to the bottom and click Save and Next. And then what you are looking to do is prescribe a medicine. Now, if you are using CBD-only products, those are effectively Schedule 4 medicines, and they fall into the Category 1. And I will show you how to search for those in the active ingredient. Now, if you are using products that have a little bit of THC in it, depending on how much THC, it will either be Category 2, 3, 4, and I think there's a 5. Although I'm not exactly sure because I've never actually prescribed Category 5. But if you click on the hourglass here and go into search, category, enter, and there is a Category 5. That's THC greater than 98%. So that's pretty strong stuff. So again, as I mentioned, if you're prescribing for anxiety or there are other contraindications like driving, which we will talk about in a second, you're probably going for the Category 1, which is a CBD only. If there are no contraindications and you want to address chronic pain, insomnia, there are no issues with driving, then you might want to choose one of the other ones. For the purposes of this tutorial, we're going to use a CBD predominant product, which is Category 1. Select. Dosage form, again, this is where you decide whether you're using the oils or whether you're using the flowers. Again, as I mentioned, typically I've seen most people prescribe oils. And then if you are looking for the oils, you basically just scroll down, oral liquid, select. And the indication at this point, you just write in whatever you want or you can search. Again, as I mentioned, we mainly use CBD only for anxiety. Having said that, sometimes you can use a little bit of THC, but again, that comes with the restrictions that we're going to talk about in a second. And then this question, if it is a Schedule 4 drug, so CBD predominant, then you actually don't have to apply to the state or territory health department. So you'd click no. If you click yes, you have to choose the state that you're in. Again, we're in WA, and then it will make you just fill in those details one more time for the state government. Let's click on no. You don't have to submit a Category A notification. I've never done that, so I'm pretty sure you don't have to do that. Hopefully the TGA doesn't write to me saying, why haven't you been submitting those as well? So here you can click down. This is a bit of a summary. You don't have to fill in any of those bits. You only have to fill in the intended date of supply, and I usually choose a few days from today. Save and next. This is where you pop in the details of your patient. We are going to be prescribing for Cherry Ripe, who isn't a real patient, but her initials are CR. Her date of birth, 1/1/1940. I'm pretty sure she's female. You don't really have to fill in these bits, but you do have to fill in the diagnosis, which is anxiety. Now, at this point, you do have to put in a little bit of a clinical indication. Again, you don't have to write an essay here, and you can probably use ChatGPT to fill this bit in, although I haven't, so I'm not sure you're actually allowed. But here's an example of what I would write in these kind of situations. And in terms of details of intended monitoring, this is what you can write here. You can just copy and paste this. And again, this is from one of the pharmaceutical companies that did the training for me. You have considered the approved and available treatments for this patient. Now, as I mentioned again, have they had counseling? Have they gone through antidepressants? Have they had the right counseling? If you have, you click yes. And then generally you wouldn't really add any additional information to support your application. Save and next. So this is your submission, and you just scroll down to the end and you just click on yes. And at that point you click submit. Now you will get an email back from the TGA confirming that you have submitted the application. And typically within about 2 or 3 working days, you will get the approval. Now what you have to do is once you get the approval, you print everything out and the prescription for the product that you want to prescribe, and you give both of those to the patient. The patient takes both of those documents, so the prescription and the approval from the TGA, to the pharmacy, and only then will the pharmacy dispense the medication. If they just take the prescription there and they don't have the written approval from the TGA, they just won't get medicinal cannabis. So thankfully, pharmacies are pretty strict about it. Now, to be able to access the prescription, you go obviously into your current medication and you add, and here you have to look for the product that you're looking for. So in our case, we were using a lot of and we have a few preparations here, and then you can kind of go through the process. Now, it is possible that this isn't here yet, so you do have to create your own prescriptions. Now, to do this in best practice, you have to go back to the home page and click on Setup and Custom Preparations. And here, you basically just add in what you're trying to prescribe. So you add in the name, you'll add in the strength, you'll add in the form. Again, is it an oil? Is it a flower? And then you just basically go through the process and click on save. And then you will be able to access that in your current prescriptions, just like I showed you. Now, another thing that you have to remember when you're going through the prescription process is you need the patient to sign a consent form. And there's a really great example of a consent form on this website. As I mentioned, we are in Western Australia, in Perth. And this is the website of the Government of Western Australia, the Department of Health, effectively. Scroll down to prescribing, and there are a few links here that you can click on if you're interested in reading a little bit more about this. But this is the consent form that I'm talking about. And you can have a read through of this, and this is the one that we are using, and we are also asking patients to sign this as well. Number 4 is driving. And obviously a lot of people are talking about this because the rules are different in different states. Now, as far as I'm aware, in states like Tasmania, you are able to drive even if you are on THC preparations, as long as you're not impaired. However, in WA, they're pretty strict about it. If you are on preparations that contain THC, you can't drive. If you're on preparations that contain CBD only, well, then there's no issue and you can drive. Now, this can be really frustrating for patients who seem to be getting the benefit from products that have a little bit of THC, but the rules are just so strict. So they often ask, what if I take CBD in the morning, but then I use the THC at nighttime? So they're trying to figure out how long will the THC stay in my system, and if I do get checked, will I get in trouble? And you kind of have to decide as a clinician whether you want to go down that rabbit hole of deciding that, yeah, that's probably okay. If you do look at the Department of Health website, it very clearly says it is recommended that patients do not drive whilst being treated with medicinal cannabis. And as far as THC goes, I know that within the saliva will go away probably within a few hours, but then it can stay within the body for many weeks if they do a different test checking for it. And so strictly speaking, in WA at the moment, if you are on THC products, just don't drive. If you're on CBD only products, then driving is fine because the THC is undetectable. Now remember guys, this whole field is rapidly evolving. However, personally, after about 6 months of prescribing medicinal cannabis, I have personally stopped prescribing it. And the reasons are I kind of just want to wait for more guidelines to come out, and I'm kind of waiting until we get a little bit more evidence and guidance in terms of its long-term safety, and especially around issues of habituation and dependence with THC products. But what about you guys? How have you guys found the journey of prescribing medicinal cannabis? Is this something that you do? Is this something that you don't do? Let me know in the comments below, and if you have any issues, feel free to email me directly. Otherwise, good luck.